If I told everybody the risks associated with childbirth just in general, if I listed them all, I don't think anybody would get pregnant. Why do I care if you've had 3 or more C-sections? Why do I care if your uterus hasn't healed all the way up? The more C-sections you have, the more dangerous it becomes to become pregnant. Especially that happens really early in labor and there was nothing that said you couldn't progress otherwise. That is a really good candidate for a VBAC. But it is a very serious risk, and it's one that I want you to consider when you're considering your options. So don't hear me say everyone should have a VBAC. Pregnant again, but your last birth was a C-section? Have you started thinking about your plans for this birth yet? Now, normally I don't like to talk about birth preferences too early in pregnancy, but if you're newly pregnant and your first birth was a C-section, you might want to consider starting to think about your birth plans, because this time you might want to try it vaginally. In this video, we're going to discuss VBACs, or Vaginal Birth After Cesarean. We'll talk all about who should consider them and who definitely should not consider them. We'll talk about the risks associated with VBACs. In fact, we call it TOLAC in our world. It's trial of labor after cesarean. So if you hear that acronym, just kind of, put it to the side. You'll want to think of it as VBAC. So we'll talk about the risks, and then we'll go through why you might want to actually try it this time. And so those are the benefits. My name is Galloway, and I'm a certified nurse midwife, and I have worked with countless women over the years who have wanted to try a vaginal birth after having a C-section. And for the most part, I am a huge advocate for this type of birth experience. But it's not without its risks, and it's not without its absolute contraindications. So let's get into it and talk about the yeses, the maybes, and the nos, as well as the risks and benefits. Considerations. Who is a yes for a VBAC? I would say the top 2 candidates for a successful VBAC are women who had their first C-section because the baby was malpositioned in some way. So maybe your baby was breech, or maybe your baby was transverse and it didn't turn by the time it was time to give birth, and so you had a C-section. So you didn't even really get a chance to go through labor. You just had a C-section because the baby didn't want to come out head down. The other good candidate I like to think of is a person who had a C-section because very early on in labor, their baby with their last pregnancy showed us that they just weren't tolerating labor well. We call that fetal intolerance of labor. And when especially that happens really early in labor and there was nothing that said you couldn't progress otherwise, that is a really good candidate for a VBAC. Now, there are some not as good candidates out there, but not absolute contraindications. So those people might be women who stopped dilating at a certain point. So you got to 6 centimeters and you were on Pitocin, your water's broken and all the things, and you just never dilated past that point. Or maybe you're someone who had a C-section for something we call arrest of descent, which is where the baby just doesn't descend in your pelvis. You get to 10 centimeters, you push for 4 hours, and the baby just never comes out that way. Those 2 are not as likely to be successful at having a vaginal birth, but it's not impossible. Maybe your first baby was just a little bit wonky in there, kind of malpositioned, didn't really come out with their head in the right position. Or maybe that baby was significantly larger than this baby was, and then you might just have a smaller baby and a better chance of having a vaginal birth. So I wouldn't say that that's a no, but it's definitely worth considering whether or not you want to try to go through labor again if it's going to potentially end up in a C-section again. The other people I would put into the maybe category are women who get to the point where they need to be induced for some reason. So maybe it's a medical induction, you develop some thing like preeclampsia and you have to be induced, or maybe you're just well over your due date and you haven't gone into labor. The risks of VBAC with induction are slightly increased, and so that's not absolute contraindication, but I would say it does fall into the maybe category. We should definitely consider this. Now, if you're out there and you've had something like this in your history and you're wondering what your chances of success are for your next pregnancy, there's actually this cool tool called the VBAC calculator. And you put in kind of all your birth history, the details about how long you were in labor, how far along you were, what happened in the end, why you had the C-section, and it spits out a percentage of likelihood that you will be successful at a vaginal birth. So we don't necessarily use that to fully guide us and are helping you make that decision, but I think it can be a pretty fun tool to use and might help you decide if you want to try a VBAC. So again, I'll put that link in the description and you guys can check that out if you want to. Let's go next into the absolute no's. These are people who should not consider a vaginal birth after C-section. The first one is anyone out there who had what we call a classical incision on their uterus during their first C-section. Now, here in the United States, we don't do those very often. They're mostly for really premature babies, but I do find that they're still sometimes being done in other countries. And if you're not sure what was done during your first C-section, then you definitely want to get those records to make sure that your C-section incision on your uterus, not on your abdomen, it doesn't matter which way it was here, it matters what was on your uterus. With the C-section incision on your uterus, you want to make sure it goes this way, horizontal, not this way. This way is an absolute no. This way is okay. Other people who are absolute no's are women who've had 3 or more C-sections. Most institutions who allow VBAC will allow you to do it after 1 prior C-section. A lot of institutions who allow VBAC will allow you to do it after 2 prior C-sections, but nowhere, pretty much, will allow you to do it after 3 prior C-sections. And we're going to talk about the whys of that later in this video, so make sure to stay tuned. One of the other things that I pretty much consider an absolute no, but could maybe be in the maybe category, is what we call a short pregnancy interval. So if you had a baby less than 18 months prior to your next due date, or you got pregnant essentially within the first 6 months postpartum, you really shouldn't be having a vaginal birth after C-section. You really need 18 months to 2 years for your incision on your uterus to heal well enough for your uterus to contract in a safe manner during labor. So what do I mean by all that? Why do I care if you've had 3 or more C-sections? Why do I care if your uterus hasn't healed all the way up? We're going to talk about the risks next. And the number one risk that we very much care about is called uterine rupture. Now, it's not a super common thing that happens. The risk of uterine rupture is about 1% for all VBAC attempts, but it is very, very serious. And what uterine rupture is when the incision from your old C-section opens up prior to when you give birth. And that happens most of the time when the uterus is contracting. Unfortunately, it can happen to some people just because during their pregnancy, even when they're not even in labor. That's super, super rare. So don't freak out about that, please. I have rarely seen that, but we have seen uterine rupture when somebody contracts regularly, like during labor, on a C-section incision. And so when you are thinking about whether or not you want to have a vaginal birth after a C-section, you want to consider the risk of uterine rupture. And why it's so serious is because when that incision opens up, what can actually happen is you can bleed really, really heavily, which can pose serious health risks to both you and your baby. And in some cases that, those health risks are so severe that, you and the baby could not make it. But it is a very serious risk, and it's one that I want you to consider when you're considering your options. One of the other things that I like you to consider when you're thinking about a VBAC is that if you try labor and you don't succeed in a vaginal birth, then you have a similar experience to what you experienced the first time. And I will tell you that women who labor for really long periods of time and they make it to 6 centimeters and they don't progress further, or they make it to pushing and they can't push their baby out. Those women who end up with a C-section tend to be exhausted and have hard labor stories, and really most of them don't love their experience. So if you're one of those people that kind of falls in that maybe category and you're considering a VBAC, that's one of the things to think about, because if you did it the first time and you didn't love having to labor so long and end up with a C-section, then you're probably not going to love it the second time either. And if you're in that maybe category, your success rate is not quite as high as those of you in the yes category. Benefits, however, are a bit of a longer list. Like I said before, love VBACs. I really advocate for them when I get the chance. I think one of the huge benefits of having a VBAC is that you go through labor, you have a vaginal birth, and your recovery time is a lot shorter. And especially if you have other little kiddos at home that you need to be taken care of, it's harder to be able to recover from a C-section than it is to recover from a vaginal birth. And so that's one of the main things I talk to women about if they're trying to decide between a vaginal birth and a repeat C-section is, what's going on at home? Do you have a 2-year-old who's going to need you and you can't run around after a C-section? So you might want to consider a vaginal birth instead. The other thing to think about is what size family you might be planning. Those of you who are planning big families and you had a C-section with your first baby, the more C-sections you have, the more dangerous it becomes to become pregnant. And really, you don't want to have more than, a handful of C-sections before you should really consider not having more children, just based on the risks of continuing to get pregnant after having so many C-sections. That risk of uterine rupture increases even without labor. There's risks of having that many abdominal surgeries. So if you're wanting a big family and you had to have a C-section with your first baby, if it's not an absolute contraindication, I would really encourage you to consider a vaginal birth this next time, because that will help you be more successful at having more children in the future. And of course, risks of vaginal birth exist, right? If I told everybody the risks associated with childbirth just in general, if I listed them all, I don't think anybody would get pregnant. The risk of vaginal birth versus the risk of C-section is slightly less. And so that is one of the benefits of doing a VBAC, is you are decreasing the risks associated with childbirth just because you're avoiding surgery. Now, if you've had a C-section before and you're trying to decide that if you want a VBAC and you ultimately decide that you don't want to do that, kudos to you. That's totally a great choice as well. In fact, I would say that for those of you in the maybe category, choosing to have a scheduled repeat C-section could end up being a way less stressful experience. Number one, you get to plan your birth, which how many people actually get to plan the day of their birth? Not a lot. Now, of course, you could go into labor before then. That's not going to happen to most of you. Most of you are going to show up on your scheduled C-section day and you're going to have your baby. And you will have slept the night before, and hopefully at least a little bit, and you will feel excited and you don't have to go through the labor pain, and it just can be nice. So don't hear me say everyone should have a VBAC. If you're on the fence and you want to just do a repeat C-section, there's some significant benefits to that. Not to mention, if you're considering birth control and one of the things you're thinking about is having your tubes tied, hey, super easy to just get that done right at the same time. We can do your C-section and your tubal all in the same surgery. So it can be a win-win for some people. Now, there are some institutions out there that do not allow VBACs, and mostly those are for safety reasons. And a lot of that has to do with size of hospital and staff available and things like that. So maybe you're at an institution that doesn't allow VBACs, and maybe you are. But if you have had a C-section before and you're considering a VBAC, I encourage you to ask that question, because the sooner you find out the answer, if you're considering a VBAC, the sooner I would encourage you to transfer to somewhere that does allow VBACs. Some places won't actually allow you to transfer late during your pregnancy, And most places aren't going to allow you to VBAC if they haven't done your prenatal care. So that's why I say, I don't love talking about birth preferences early on in a pregnancy unless we're considering having a VBAC. Because if you are, you need to make that decision sooner rather than later, especially if you're in an institution that doesn't allow them. Sounds like you guys have some decisions to make, and I hope this video has been helpful for you as you consider all your options. If you don't remember much about your C-section, or if you just want to learn more about the process and how things typically go during C-section so it helps you make your decision better, I encourage you to check out this video all about C-sections. Stay healthy, everybody.